Introduction. Welcome, medical students, to today's lecture on dystonia. Dystonia is a complex neurological disorder characterized by involuntary muscle contractions and abnormal postures, resulting in twisting and repetitive movements. In this comprehensive script, we will delve into various aspects of dystonia, including its overview, genetic basis, neuroanatomy, clinical manifestations, treatment modalities, comorbidities, neuroimaging findings, non-motor symptoms, emerging therapies, pediatric onset, and conclude with a summary of key points. Now, let's begin exploring the intricacies of dystonia in detail. Dystonia is a heterogeneous movement disorder that can manifest at any age. It affects approximately 1% of the global population, making it one of the most prevalent movement disorders. The hallmark feature of dystonia is sustained or intermittent muscle contractions leading to abnormal postures or repetitive movements. These motor abnormalities may be focal, segmental, or generalized, depending on the distribution of affected body parts. Dystonia often has a significant impact on patients' quality of life, affecting their daily activities, mobility, and social interactions. The exact etiology of dystonia remains elusive, although both genetic and environmental factors are believed to contribute to its development. Recent advancements in genetic research have shed light on the underlying genetic basis of dystonia. Many forms of dystonia are now recognized to have a genetic component. Mutations in various genes, including TOR1A, TOP1, GCH1, and DYT6, have been implicated in both early onset and adult onset dystonia. Understanding the genetic basis of dystonia is crucial for accurate diagnosis, genetic counseling, and potentially targeted therapeutics in the future. The basal ganglia, comprising the striatum, globus pallidus, substantia nigra, and subthalamic nucleus, play a crucial role in the pathophysiology of dystonia. Abnormalities in the circuitry and neurotransmitter systems within the basal ganglia disrupt the balance between inhibitory and excitatory pathways, leading to motor dysfunction observed in dystonia. Alterations in the GABAergic and dopaminergic systems have been implicated in the pathogenesis of dystonia, thereby providing potential targets for therapeutic interventions. Focal dystonias primarily involve a single body region, such as the eyes, blepharospasm, neck, cervical dystonia, hand, writer's cramp, or larynx, spasmodic dysphonia. These forms of dystonia often have specific triggers or exacerbated by particular tasks. Management strategies for focal dystonias include botulinum toxin injections, oral medications, physical therapy, and occupational therapy, depending on the specific patient and their functional impairments. Unlike focal dystonias, segmental and generalized dystonias involve multiple body regions, leading to more complex motor patterns and functional limitations. Examples of segmental dystonias include MESH syndrome, involving cranial and cervical regions, and hemidystonia, affecting one side of the body. Generalized dystonias, such as DYT1 dystonia, affect multiple body regions symmetrically. The management of segmental and generalized dystonias often requires a multidisciplinary approach, combining pharmacotherapy, botulinum toxin injections, physical therapy, and counseling. Botulinum toxin injections have revolutionized the management of dystonia, particularly in focal and segmental forms. Botulinum toxin acts by blocking the release of acetylcholine at the neuromuscular junction, leading to localized muscle relaxation. The selection of target muscles, dosing, and injection techniques are critical to achieving optimal outcomes. However, it is important to consider potential side effects, such as muscle weakness and dysphagia, in patients treated with botulinum toxin. Deep brain stimulation, DBS, has emerged as an effective therapeutic modality for medically refractory dystonia. By implanting electrodes in specific basal ganglia nuclei, such as the globus pallidus interna or subthalamic nucleus, DBS modulates aberrant neural activity and restores physiological motor control. DBS is particularly beneficial in patients with generalized or segmental dystonias who have limited response to conventional treatments. Nonetheless, careful patient selection and surgical expertise are crucial for favorable outcomes. Dystonia is not merely a movement disorder but also associated with a range of psychiatric comorbidities. Anxiety, depression, and psychiatric distress are frequently observed among individuals with dystonia, likely stemming from the impact of chronic motor symptoms and functional limitations on their emotional well-being. Comprehensive management of dystonia should address these psychiatric comorbidities through psychological support, counseling, and if necessary, pharmacotherapy. Neuroimaging techniques, such as magnetic resonance imaging, MRI, and functional MRI, have provided valuable insights into the structural and functional brain abnormalities associated with dystonia. Imaging studies have revealed alterations in the basal ganglia, motor cortex, cerebellum, and thalamus in patients with various forms of dystonia. These findings further contribute to our understanding of dystonia's pathophysiology and may help identify potential biomarkers for diagnosis and treatment response. While dystonia primarily affects motor function, there is increasing recognition of its associated non-motor symptoms. These non-motor symptoms include pain, sleep disturbances, cognitive impairments, autonomic dysfunction, and sensory abnormalities. The presence of non-motor symptoms underscores the need for comprehensive multidisciplinary care in dystonia management. The field of dystonia research continues to evolve, with promising emerging therapies on the horizon. Novel treatment modalities, such as focused ultrasound, transcranial magnetic stimulation, and gene therapy, are being explored as potential avenues for future intervention. Additionally, advancements in neuroprotective strategies and personalized medicine hold the promise of more targeted and effective management of dystonia in the coming years. Dystonia can manifest in childhood, posing unique challenges in diagnosis and management. Pediatric onset dystonia often presents with distinct clinical features and genetic predispositions. Early identification and intervention are crucial to minimize the impact of dystonia on a child's physical, cognitive, and psychosocial development. Management strategies in pediatric dystonia encompass pharmacotherapy, botulinum toxin injections, rehabilitation therapies, and, in select cases, surgical interventions. In conclusion, dystonia is a complex neurological disorder with a wide spectrum of clinical manifestations and underlying pathophysiology. Genetic factors, abnormalities in the basal ganglia circuitry, and neurotransmitter dyshomeostasis contribute to its onset and progression. Diagnosis and management of dystonia require a multidisciplinary approach, encompassing pharmacological, physical, and surgical interventions tailored to individual patients' needs. The field of dystonia research continues to advance, with ongoing efforts to improve diagnostics, develop targeted treatments, and enhance patients' overall quality of life. Thank you for attentively following this extensive script on dystonia. I hope you found this lecture informative and valuable for your future medical practice.